You may have heard of the opium poppy or psilocybin mushrooms, but this shrub behind me, the Tabernanthe iboga from West Africa, contains a different type of Schedule 1 controlled substance that you might not have heard of, and that's ibogaine. So ibogaine is a hallucinogenic psychoactive compound, and if we take a look at the chemical structure, it's easy to see that tryptamine backbone like we find in serotonin, as well as psilocybin in psilocybin mushrooms, as well as dimethyltryptamine, the main active ingredient in ayahuasca. So it's no surprise that serotonin receptors are being activated quite well, but what we don't see is that it's actually quite a dirty drug because it has agonism at opioid receptors, sigma receptors, and NMDA receptors. So we also get that dissociative-like effect that we see with ketamine. So since it's a dirty drug and there isn't exactly an established dose for ibogaine, that means there is a slurry of side effects, namely cardiotoxicity. Now, as scary as that sounds, people don't just take this medication for a psychedelic experience. It's been thought to be a treatment for depression, anxiety, PTSD, and even substance use disorder. And of all states in the United States, Texas actually passed a bill to work with the FDA to start conducting clinical trials to prove its efficacy. And lo and behold, there actually is potentially some benefit for ibogaine in treating these conditions. Unfortunately, as of a few months ago, we've been able to completely isolate ibogaine, so that way we can find the correct dose to mitigate the most risks that we can and optimize the benefit for treating such conditions as substance use disorder. So if you have debilitating depression, anxiety, PTSD, or substance use disorder, stay tuned. We're fine-tuning this medication to mitigate the risks and optimize the benefit.